Hello, good afternoon. We are here in Oakland, California with Diane Appelbaum for MEDIC. Hi, Diane. How are you doing?
I'm good. How are you?
Good, good. So let's talk about MEDIC. What is MEDIC?
MEDIC stands for Medical Education Cooperation with Cuba. And it was founded, it's a nonprofit organization founded in 1997. And the history of how it was founded is very interesting because it has to do with a study that was conducted by our international director, Gail Reed, and our present board chair, Peter Bourne. And they did a study on the effect of the embargo on food and medicine in Cuba. And it was published and it was republished. And what they found was really interesting, that despite the embargo, which had really dire consequences in a lot of areas, the basic health indicators of Cuba remained pretty good. They didn't go down that much. And how did they do that? How did they do that with, the embargo, with Russia, the Soviet Union pulling out? How did they do that with so few resources? So Gail and Peter thought, wow, we have a lot to learn from Cuba. They formed the organization first for medical students and public health students to be able to go down basically to see what Cuba has been able to do with such scarce resources. We think that the Cuban healthcare system has excelled in so many areas. The hard data is absolutely proven by other organizations to be true. They have one of the lowest infant mortality rates in the world. They have all of their health indicators are on par with ours and with Canada's, yet they have, basically a gross national income per person of less than $5,000 a year. We think there's a lot to be learned for health professionals and health policymakers on how to have a very good health system with not putting half the resources we do into our broken health system.
So, what is the current mission and the vision of MEDIC?
Health equity and improving health for all globally. We do this in a variety of ways. MEDIC has several programs. We started with student programs where we sent medical students and public health students to Cuba to do rotations, and they would stay a month or 6 weeks. And those were wonderful programs. The students got to go out with the family doctors and work in the communities. And they often said these were life-changing experiences for them. That program had to be curtailed in 2004 under President Bush, who greatly restricted travel to Cuba and eliminated all possibility for these kind of student programs we had. During that time, we've had about 1,500 medical students who have had this experience in Cuba, and now they're all becoming doctors. So we're very interested in finding out how the Cuba experience affected them and how it influenced their choice of practice or their choice of work. Our suspicion is a lot more will go into public health and primary care and also serving the needs of the underserved. So we don't do that program anymore, but we do consult with a licensed travel provider called Madazul on research programs for health professionals. So health professionals can still travel to Cuba on a general license, and we, because of our long experience with the health institutions in Cuba, we can help develop a research program which is tailored to the needs of the researchers. We have another program, excuse me, here in Oakland that we've done for the past 3 years. We call that Community Partnerships for Health Equity. And that's where we consult with people who want to go to Cuba and look at the Cuban healthcare system. But the difference is we we try to involve people who have some influence in the community in health. So in Oakland, we have had a 3-year project where we've involved Children's Hospital, La Clínica de la Raza, the Alameda County Public Health Department, Alameda County Medical Center, Ethnic Health Institute, and the Asian Health Center. And very high up members of all these organizations, including CEOs, have gone to Cuba to learn practices and policies and examples and models which they might be able to apply here in Oakland. During these research programs in Cuba, the Oakland group met students, U.S. students who are going to school in Cuba. These students were very enthusiastic about their values and their medical ethics and their attention to equity. And so they are really rallying around these students. So when they come back during summers, they're providing opportunities for them to go shadow in the clinics here, so that they can be more familiar with the medical system back in the United States. ELAM stands for Latin American Medical School. And there are approximately 9,000 students attending this medical school. It's the largest medical school in the world. And all these students at the medical school in Cuba are not Cubans. They are from poor countries, mainly in Latin America, the Caribbean, Africa, and they are the result of this brilliant recognition that there are not enough doctors in the world. There are enough doctors in certain societies that are affluent, but in these countries where they need healthcare the most, there is a real scarcity of doctors. There's also a problem of the brain drain. So doctors from Africa and India and Latin America who get trained then leave to come to the United States. So the whole idea of the Latin American Medical School is to provide medical education for poor, largely indigenous, bright young people who otherwise wouldn't get to go to medical school. And in 2001, after Hurricane Mitch, I think that's when it started. And sometime in there, the Black Caucus of the U.S. and the Hispanic Caucus approached Fidel Castro, and they said, well, you've got this wonderful medical school based on this premise that underserved communities need more doctors. We have underserved communities in the United States. We have places where doctors won't go, very poor communities, and we would like you to consider accepting some medical students from those communities who can be trained in Cuba to be doctors and then go back to those communities in the United States. So this is a very gutsy proposal. Basically, Cuba's an underdeveloped or developing country, providing medical education free to not only other poor countries, but to poor students from the United States. So this, right now, so he made an offer actually of 500 scholarships. We have 150 there now, U.S. students in the medical school.
Well, ya escucharon, muchachos. Aquí nos despedimos desde Oakland, California. And aquí estuvimos con Diane Appelbaum y me despido, Jasmine Morelos.
La raza Chronicles y para Desde las entrañas de la bestia.